Hands should be washed before consuming food, after toileting, and after touching inanimate objects that are potentially contaminated, such as door handles and pens. In a hospital setting, hands should be washed with both water and soap or alcohol-based drops, before contact with the patient, before aseptic care, after bodily fluid exposure, after patient contact, and after contact with patient surroundings. To perform hand washing correctly, first it is important to remove all watches and jewellery, cover any cuts or abrasions with a band-aid, and to keep nails short so no bacteria builds up underneath them. To avoid most commonly missed areas, wash hands for 40 to 60 seconds following the simple techniques as shown in this video.
When taking blood pressure, ensure the patient is seated and the arm is supported at heart level. Attach the blood pressure cuff to the patient's arm with the centre of the bladder over the brachial artery. Determine the baseline by palpating the radial pulse and then inflating the cuff until the pulse can't be heard, and then continue to inflate the cuff 30 mm of mercury above the baseline. Locate the brachial artery and place the diaphragm of the stethoscope over the artery. Slowly release the cuff at a rate of 2 to 3 mm of mercury. When the first sound is heard, this is the systolic pressure. Continue to listen until a second noise is heard, and this is the diastolic pressure. The blood pressure is the systolic pressure over the diastolic pressure. Continue to deflate the cuff completely and remove from the patient's arm.
To take the temperature using a digital thermometer, you first ensure the patient is in a comfortable position and remove the thermometer from the container. Place a disposable speculum over the earpiece and insert the earpiece into the ear canal. Press the button to record the temperature taken. Record all observations on an obs sheet. Dispose of a speculum afterwards. Pulse. To take the pulse, place the arm in a comfortable position and place the first 2 fingers on the radial pulse. Count how many beats there are in a 30-second period and then times the amount by 2 to get the beats per minute. Whilst doing pulse, also count the number of respirations in a 30-second period.